My name is Ricky Tennyson. I'm your community health representative for Region 2. I work for the local health department. It is my job to ensure that our community is provided with adequate health care, health promotion, and disease prevention services. The health promotion and disease prevention efforts that the community health reps provide have also helped people from the community improve and maintain their health. Because I'm a trusted member of the community with a close understanding of the community language and traditions, I am here to serve as a link between the clinical setting and the community to facilitate access to service and improve the quality and cultural competence of service delivery. I hope to assist by increasing health knowledge of patients and communities through a broad range of activities such as transportation to health visits, outreach programs, community education, informal counseling, social support, and advocacy. As as the community health representative, we we hope to provide funding and training and technical assistance to the community in order to ensure that our community is clean and everyone is healthy.
My name is Heather Ness. I work as a toxicologist for the Agency of Toxic Substances and Disease Registry, or ATSDR. ATSDR is charged with the Superfund law to assess the presence and nature of the health hazards at specific Superfund sites in order to help prevent or reduce further exposure and the illnesses that result from such exposures, and to expand the knowledge base about health effects from exposure to hazardous substances. I will be talking about the hazardous chemicals found around the Universal Oil Product site, most especially the waterways that are contaminated from the Superfund site.
Hello and good morning. My name is Kylie Kistner and I work as an outreach coordinator from the EPA office in Region 2. As the outreach coordinator, it is my job to keep my community up to date on the progress made for the environmental and community safety in regards to the Universal Oil Products Superfund site. I'm pleased to say that the site has come a long way since 1982 when the preliminary actions for cleanup plans began to be made. In 1990, remediation was done by removing liquids, sludges, and sediments from these surface impoundments under New Jersey Department of Environmental Protection oversight. We also worked on the long-term cleanup actions with the Record of Decision in 1993 and updated in 1998 to address the soils and groundwater that were contaminated with PCBs and PAHs using thermal desorption and off-site disposal. Lead-contaminated soils were evacuated and placed under the on-site cap. Groundwater went through a treatment system from 1997 to 1998. The cleanup proposal from 2012 by the EPA proposed that 27,000 cubic yards of contaminated sediment, soil, and debris from the area in and around the previous wastewater lagoon and adjacent stream channels would be evacuated, dewatered, and taken off-site for disposal.
The Universal Oil Products Superfund site is categorized as current human exposure not controlled, due in part because the contaminated potential dangers for ingestion of fish and crabs from the Berries Creek and Ackermans Creek waterways. Fish tissues has been collected from the areas and have been found that they contain elevated levels of 5 out of 5 top bioaccumulated contaminants, those being mercury, polychlorinated biphenyls, also known as PCBs, dioxin, dechlordiphenyl trichloroethane, also known as DDT, and chlordane. Both PCBs and mercury compounds are listed on the Toxics Release Inventory Program, which cover chemicals that cause one or more of the following hazards: cancer or other chronic human health effects, significant adverse acute human health effects, significant adverse environmental effects. Though PCBs are no longer produced in the United States, PCBs stay in the environment for many years and bioaccumulate in fatty acids of organisms, with biomagnification occurring as they move up the food chain. Eating contaminated foods exposes humans to PCBs, which can adversely affect a person's health, leading to skin conditions such as acne and rashes, possible liver damage, low birth rates, motor skill development, and decreased short-term memory in children, and is linked to certain types of cancers. Because PCBs have no known natural sources, this environmental danger is purely man-made. Mercury exposure attacks the nervous system. High levels can permanently damage the brain, kidneys, and developing fetuses. Effects on brain functioning may result in irritability, shyness, tremors, changes in vision or hearing, and memory problems. Exposures to pregnant women passes mercury to the fetus where it accumulates, causing brain damage, mental retardation, incoordination, blindness, seizures, and inability to speak. Fish from the waterways have shown contamination from 8 other contaminants, including lead. Fish consumption advisory signs have been posted in the area affected.
Okay, and to kind of piggyback off what Heather was talking about as far as the contaminants and the things that they do to affect us as a human population, we just want to be sure that our problem is addressed, that everybody is aware of what's going on and how these PCBs and the mercury and all these man-made things from our Superfunds can affect us and harm us, make us sick, like the standing groundwater, contaminating our soils, the birth defects that children have that were born to parents that live close to these super sites. We just want to make sure that we make you aware of this problem and that we work together as a community to clean it up. That way we can help risk prevention and help to prevent people from getting sick in the first place. And that way we all can just stay healthy as a whole, as a community. And we want to be sure that everyone is receiving adequate treatment, and the people that need it first are getting reached first, that are in the highest contaminated populations. And we just want to work together as a community to ensure that we're a healthy one.
And so as an outreach coordinator, we often receive questions from concerned citizens. So today I just received a question. So the question is as follows. As a community outreach coordinator, how are you working with the community to raise awareness to decrease contamination of groundwater and soil? So in an effort to continue for the environment to remain safe during the cleanup process, our Region 2 remains making a visible difference in communities through the cleanup and reuse of Superfund sites. We also work with stakeholders to protect human health and the environment by encouraging them to focus on reuse opportunities. And these help communities and cleanup managers consider reuse during cleanup planning and evaluate remedies already in place to ensure appropriate reuse at cleaned up sites. In addition, the EPA participates in partnerships with communities and encourages opportunities to support Superfund redevelopment projects that emphasize environmental and economic sustainability. So some specific reuse support efforts we follow include identifying and evaluating local land use priorities to align these priorities with site cleanup plans through the reuse planning process. We also facilitate cleanup and reuse discussions to help resolve key issues between parties interested in site redevelopment. We support targeted projects intended to help Region 2 communities and EPA find the right tools to move reuse forward at sites. They make efforts to help address communities and developers' liability, safety, reuse concerns related to super site reuse through development of educational materials, comfort letters, development agreements, and environmental status reports to provide information about the appropriate use of sites. We support partnerships with groups committed to putting Superfund sites back into use, such as the Academy of Model Aeronautics, the U.S. Soccer Foundation, the Trust for Public Land, and the Rails to Rails Conservancy. Developing reuse fact sheets, videos, websites, reuse case studies, and return to use demonstration product summaries to share opportunities and lessons associated with Superfund redevelopment. These efforts overall have helped build expertise around the region, making it a bit easier to consider future use of the site and easier to see opportunities removing the reuse barriers. Even though we are not yet where we would like to be, we are ensuring to follow the necessary steps that need to be taken so that contaminated waters, lead exposure, and PCBs are no longer an issue on site. We are hoping that these reuse efforts will not only help other communities, state agencies, potentially responsible parties, and developers better understand potential future uses for Superfund sites, but the approach will begin to help stakeholders engage early in the cleanup processes, ensuring that Superfund sites are restored as productive assets for communities in the long term. Thank you.
So we'd like to thank everyone for joining us today. First, we'd like to address the problem at hand, and that's to make our community aware and work together to clean up with the plan to clean up the community and to eliminate all fun sites and potential health risks. Community involvement in this process of engaging in dialogue and collaboration with community members. The goal of a Superfund community involvement is to advocate and strengthen early and meaningful community participation during Superfund cleanups.